afternoon, and thanks for joining us. I'm Judy Simpson. By and large, it's been a pretty beautiful fall. As the seasonal transition continues, the days are getting shorter and colder, and it's important that we take care of ourselves, especially during the flu season. But we're not the only ones whose health is affected by the change in seasons. Animals, our pets, and livestock need extra attention because of seasonal health issues, and this is especially true for horses. Some insights on horse health issues related to the change of seasons. I'm joined by UVM Extension equine specialist Betsy Green and the owner of Vermont Large Animal Clinic in Milton, Dr. Phil van Harveld. Thanks a lot for coming in today. Betsy, what are some of the weather-related things that might cause problems for horses?
Well, there are several things going on, both the horses and the weather. When you think about the pastures that have been in a growing phase all summer, and even in early fall, we have some fall growth too. Suddenly, as weather's changing, getting colder, those plants are starting to get ready for winter. And they can have, they're not producing the sugars at the same type of level, and they're preparing to bunker down to survive our long winter too. But some of the big things that you can have is when there's a frost, then they go into a little bit of a shock too. And so when the horses are grazing right after that, sometimes there's some colics related to that because change in diet.
Mm-hmm. So as the forage changes, that affects the horses.
Right, and then the horses themselves, as it gets cooler, they tend to not be drinking as much water, especially some horses don't like cold water. Sometimes they're just not as, they may be active and running around, but they may not be getting as much exercise because their owners are starting to
It's
get ready.
cold.
It's cold outside too.
And so how much water should a horse drink?
They generally about 8 to 10 gallons a day.
Wow, okay.
Yeah.
And so do you see these types of things at the UVM barn?
Yeah, we actually have on several occasions had some colics. In fact, we had one just recently on a freeze or after a freeze, and the horse is okay, but it's not uncommon, and people just seem to be surprised by it because they're not necessarily thinking about what a drastic change it can have on the plants and then the horse's gut.
Mm-hmm. Or even just changing hay.
Yeah, oh yeah. And then, of course, they're changing to more hay as well from the lush pasture and much higher moisture content in the pasture as well.
So before the vet is called, what are some of the things that you would see or a horse owner should do or a barn manager?
Well, one of the things you often see is something different. It might be that your horse stops eating when they're usually...
That's always a tip-off because that's all horses love to do.
That's right. And if they stop eating, that's usually the first sign you see. But you might see things like kicking at their flank. You might see them rolling more often and not just rolling because they're trying to get dirty for you before the ride. Sweating, looking at their flank, lots of different things that, any different horses can have different levels of pain or show different levels of pain too. And so those are some of the common signs.
Now, Dr. Phil, colic can be in different sizes and shapes. So when you get called in, what are some of the things that you see?
I think the first thing we do when we get this sort of get a history, from the owner. Because, as you said, horse owners, they know their horses, and they usually can relate, what they're finding. But we sort of get a history, and then we do a physical exam, sort of the heart rate, temperature, respiratory rate. Horses' heart rates can be indicative of the degree of pain they're in or the severity of things sometimes. So we start with that. After that, do they have gut sounds present? Can we hear the intestine rumbling? And then we sort of then proceed to, we pass a nasogastric tube. They can accumulate fluids in their stomach and see that could be a piece of the puzzle. And then we also do what's called an internal exam, sort of like doing a pregnancy check on a cow, but we actually check on the horse to see is part of that intestine out of place.
And you can tell that by just feeling around?
Yes, you sort of can. Yes, it takes a little bit of training, but you can.
And so what are some of the medical things that might happen that you might do first?
So initially, I would say that probably 8 or 9 out of 10 colics can actually be treated on the farm, so that's the good news. So what we usually do is we give them analgesics. I think Banamine is a word most owners know at this point. And then when we pass that nasogastric tube into their stomach, we can actually pump water and laxatives like mineral oil into it, to sort of help lubricate the system. And then the other thing we can do is sometimes give them IV fluids to really rehydrate the horse again and sort of get their intestines moving.
Is this anything that a normal horse owner should be doing themselves, is medicating the animal before a vet is called?
We usually don't recommend them to do so, but we do. Banamine is a popular product, and it's now in paste form, not only injectable. We do recommend most horse owners to have it at hand, but we always prefer to get a call first so they can tell us what's going on, so that we can sort of guide them. Go ahead and give me a call back, or if you feel it's severe enough, we can say give it, we're heading right out.
Why do horses get colic? I mean, we know some of the reasons that causes colic, but why do horses colic?
It's their weakest link. It's their architectural design of how they were put together is really the problem here. When we relate to the fall colics, I think there's two big things that we see. One is, like Betsy said, we're switching from grass to hay, which is much drier. Horses don't sweat as much because the temperatures go down, and then they don't sweat as much sodium. And sodium sort of is that determinant of how much you drink. I call it the pizza effect. You eat some pizza, you will drink a lot. Because you have a lot of sodium in the system. So when horses don't lose it, they don't drink as much. The manure in the system dries out a little bit, and because of that, it becomes a little bit stagnant, and it can sort of clog the system a little bit. The other thing, as Betsy mentioned too, the changes in the green grasses. Sometimes we get that fall lushness of the grass. We have to mow a little bit more because it sort of has that dark green to it again. Higher protein levels lead to higher fermentation. Byproduct of the fermentation is gas production, so the intestine will overfill with gas sometimes, and they can pass that, leading to what we call a gas colic.
Horses can't throw up. That's another problem.
Right. Right, and that's when he's talking about how the system is put together wrong. It's a one-way system. There's a valve at the beginning of the stomach called the cardiac valve, where the pressure from the stomach keeps it closed, so it only goes one way. So if they eat something bad or wrong, whatever, it has to go all the way through the system. And so that's one reason that horses are so much more prone to colic. And also they have the cecum, which is the stuff that has the good bugs to help further digestion. That's also in the wrong place. It should be between the stomach and the small intestine, but it's after most of the absorption has taken place. And so when there's a shock to the system, if they get into the grain room or the change in diet, it can kill those good bugs that are helping digest and end up causing a toxicity too.
And when you're talking about intestines, how many feet of intestines are we talking about?
A horse can have somewhere between 100 to 120 feet.
Wow.
Yeah, so they have about 70 feet roughly of small intestine and about 30 feet roughly of large intestine.
So they're talking a needle in a haystack. If your horse colics, can you really tell maybe where the blockage would be? I
think things have progressed over the years. I think the internal exam is a big indication of what we could think is going on, but we also, ultrasounds have become very modern nowadays.
Okay, let's talk a little bit about what happens when the decision is made that walking the horse and all these things that we've done on the farm isn't working. Then surgery is or isn't an option?
Well, from the horse owners or managers' perspective, it may come down to economics, because it's very expensive to do surgery, and depending on the horse, although you might love to do everything you possibly can, if it's going to make you go broke and then you can't care for your other animals, it might not be an option. It also depends on how the horse shows signs and whether or not it is a possibility. But I mean, we have had two horses that one had an impaction colic from the lack of water, one had a gassy colic. Neither were surgical candidates economically, although we would have loved to. Right. But the gassy colic, it looked very, very serious, and he ended up getting some fluids and passing a lot of gas and never had to be touched, and it turned out he was just a wimp. The other guy didn't show as many signs, and he had an impaction. He ended up dying before the vets wanted to do it at the university. They said, we love him too, we'll try it, we'll figure out the price after. But he didn't make it because he was stoic and didn't show the signs.
Interesting. Yeah. So when a horse does go to surgery, Dr. Phil, what happens?
Well, the decision to go to surgery is sort of based on when medical treatment that we are attempting fails.
Now we're going to be showing some pictures here of a surgery, so if that's something that you're a little squeamish about, you might just want to listen as opposed to watch, but go ahead.
So as we said, the medical colics that treating them in the field is the most common version. But there comes a point that medicine can undo, something that's completely out of place, and medicine can undo something that is dying inside of the horse. So, based on the level of pain of the horse and the unresponsiveness to pain medication, internal exam findings that are consistent with something that is out of place, or even, as you can see here, this is sort of a depiction of the internal exam, which we're sort of feeling an impaction. That is the pelvic flexure, that's the large colon, and you can see it's very, very full. And then we also have lactate levels. It's a new diagnostic tool we've been using over the past 2 years that can tell us if there's something compromised in the abdomen. And based on those findings, we make the determination if the horse has to go to surgery or not.
Okay, so then what happens?
So once the determination is made to go to surgery, we sort of the first stage, and we call it colic surgery, but it's actually called an exploratory laparotomy. And the reason why is, as you can see here, we have a horse anesthetized on its back, draped out, and the initial thing is to find out what is going on and where. And once you get in there, you sort of determine the severity of what's going on, what the more specific problem is, and then we can decide based on that, we can attach a prognosis and a potential cost to that. So once we have determined that, we can tell the owner, would you like to proceed or not? So here you have an example of a large colon. When you look on the left-hand side, you can see that piece of bile on the left is very large, but the one on the right actually looks fairly empty. It's pretty empty. So that's a classic impaction. There's a large amount of dry manure that has stopped flowing through the intestine, and then we need to go in and actually empty that out.
And so can an intestine be twisted too?
It can, and that's part of that faulty architecture that they have. They can literally, their large colon like ours is attached and theirs isn't. And you can see right there, we literally have a side table. We can pull that entire large colon out and sort of put it on a side table because it's free floating in the abdomen. There's nothing holding that colon in place. So once the gas builds up, it sort of can move around in there.
Wow, and so, when a horse rolls, that can actually twist and make things worse.
Yes, the level of pain that they get from there, they're sort of trying to find a way to undo what's going on in their abdomen.
Okay, then what happens?
So the next step, if you have, for example, this case where you have that big, large colon or it's impacted, we actually have to make an incision in the intestine, and we literally put a hose in there and sort of sterilely massage the contents, rehydrate them, and empty everything out. So we literally take all the gas out. So this is sort of that same colon now sutured closed, an incision was made, everything was completely emptied out of there, and now we can sort of put a healthy piece of intestine back in the horse, recover the horse, and that horse would carry a good prognosis at that point.
Really?
Yeah.
Even after all that surgery?
Even after all the surgery, and as far as the cost goes, as well as we talked, a lot of people do have insurance nowadays, so that has really facilitated with people to be able to cover some of the costs of the surgery.
And quickly, ballpark-wise, what would a surgery like this cost?
I think the initial portion of the surgery to sort of get the horse to the hospital, anesthetize it, and sort of get to that point of surgery that we can attach a prognosis to it is about $3,500. And then the overall cost, if you proceed with surgery and you wake up the horse, usually somewhere between $7,000 and $9,000.
Wow. So obviously we want to avoid having this happen. So what are some things we can do?
So make sure your horse has access to fresh, clean water and non-frozen, making sure that you're keeping an eye on them, and when the pastures change, that you're adapting as best you can, rather than having them just change when the grass changes, so that they're prepared. Make sure that you're checking vitals, you know what's normal on your horse, so that you notice what's abnormal. Those are some of the key things. Anything that you'd add?
No, and I think that, make sure that your horse is drinking, and also knowing how much they drink, because sometimes people have those automatic waterers and they don't know,
Right.
And
no, I left to lug buckets, so I'm very aware of how much people are drinking.
That's good. Yeah, so that's a big key to that, yes.
And how about like a supplement in the feed maybe, or?
Well, some people will put supplements in the water and then it can cause them not to drink, but you can actually add some salt if you wanted to try and increase the thirst.
Yes.
But you don't want to make a change that will stop what they normally do. The key is normality, and that will help them. The sudden changes are often what ignite any type of colic.
So Dr. Phil, how can people find out more about your practice?
Well, they can either call us at 802-893-6800, or they can go to our website at www.vlac.net.
On that note, get ready for a nice long winter.
Yes.
Thank you both for joining us today.
Thank you.
Sure.
That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.